So good morning, good afternoon, good evening. Bom dia to my fellow Brazilians. This is IFA's Global Café, live from Toronto. My name is Bruna Suertes, Director of Communications at the International Federation on Aging, and it is my pleasure to host today's session. The session is being recorded. It's also being live streamed through our Facebook channel. And if you have any questions or comments, please post them on the chat function. Our moderator will call upon you when we open up for Q&A. This session is very special to me because we have here a fellow Brazilian from my hometown. And as some of you know, and some of you don't, Brazil is the third largest economy in South America. The third largest economy in Americas and the largest economy in South America. And yet the inequalities are absurd for people of all ages, especially older people. But Brazilians are known to create out of thin air. And we have here today Dr. Karla Giacomin, who is one of those special people who can create so much with lack of resources. I'll hand it over to Dr. Jane Barrett now to conduct this interview. Jane, the floor is yours.
So thank you very much, Bruna. Before I introduce our guest, Karla Giacomin, I just also want to pay tribute to colleagues at the IFA from Brazil, Bruna and Luana. Bruna and Luana not only bring inspiration and thoughtful ways of working, their energy is infectious. And when we were talking prior to this Global Cafe, I noticed that Brazilians just have this innate, incredible smile. So thank you for all of your efforts. It is a great pleasure to introduce Karla Giacomin and a conversation about a panoramic vision on long-term care in Brazil, the challenges and the perspectives. Dr. Giacomin is a permanent geriatrician at the Municipal Health Department in Belo Horizonte since 1999, where she has been coordinating healthcare services for older persons. Karla has many, many hats that she wears. She works on research as a member of the Brazilian Study in Public Health and Aging. She acts as an academic in the field of medical anthropology, professor and project coordinator in master's and doctoral programs. She teaches public policies at specialized programs in gerontology at two of the largest universities. And a fact that I wasn't aware of is that Belo Horizonte is the third largest capital of Brazil, where she lives. She's an active member and president of the National Council of Older Persons' Rights from 2008 to 2012, acted as scientific director of the Brazilian Society of Geriatricians and Gerontologists, and is nominated by the WHO as an international consultant on health policies for older persons at the Strategic Plan for Health and Active Aging in Cabo Verde. Now, Karla also has different hats that she wears and has been wearing pre and during the pandemic. And that's one of the areas, Karla, that I wanted to talk with you about today. But first of all, welcome. And can you give us a sense of where you live and what you do on a day-to-day basis? You know, Brazil is one of the most densely populated countries in the world, but many of us don't understand what that's like to live and work. So perhaps if you can just sort of set the scene about where you live.
Yes, thank you, Jane, for this invitation. And I'm very proud to be here with you and with so many people. Indeed, I am a geriatrician and I work as a civil servant in Brazil. Brazil is a very unequal country. We have now more than 210 million people, and we have 34 million people that are older now. So we have more older people than many countries has in population, as Canada, for example, okay? Yeah. But we have a big problem, because as we are a very unequal country, we collect many these inequalities as we grow older. So less education in infants means less health in old age. And we fight a lot for preserve human rights and fundamental rights for older people in our country. My city has 2.5 million people, and 1 million people are old now. So we have a lot of work to do to help many citizens to give more quality of life, to achieve more quality of life in old age.
So just coming back to your speciality, which is geriatrics, how many geriatricians in, Belo Horizonte, and how many geriatricians are in Brazil? You said 210 million people, 34 million older people. So can
Yes.
you get a sense of, how many professionals?
For 34 million older people, we have 2,000 geriatricians. So it's not enough. We should have more competences in geriatrician, in geriatric and gerontology care for health public services, because we don't have geriatricians to help to work with so many people. Okay, that's another challenge. And there is another thing very interesting. We have low people. We have many posts, but we don't have people interested in occupy these posts.
Right. So you've got a lot of vacancies, you don't have the professionals, and
yes,
you're really always doing catch up,
Yeah.
to ensure. So I want to shift slightly to long-term care. Now, we are still in a pandemic. The pandemic is not yet over. But, there were certainly real challenges in Brazil, when the COVID was at its peak. In Canada, those that were most hard hit, those that, deaths most and functional dependency were in long-term care. What was happening in Belo Horizonte and Brazil, in long-term care around the time of COVID?
During the time of COVID, we worked a lot. We promoted and took part in a lot of webinars because we have a huge challenge. We don't know where they are, how they care, how many people were in long-term care in Brazil. We didn't have any information about people, about servants, about localization. So we should, before, we should know about this. So when we heard the news from Canada, from Italy, from Spain, we discovered that we should do something, or we will have a tragedy, a big tragedy in our long-term care facilities, because our long-term care facilities are very different from Canada or from Europe. We don't have resources. We don't have human resources. We don't have technical resources to care. So the only thing we have were the volunteers to help and to share information. And during the pandemic, we created the National Front for Strengthening for Long-Term Care Facilities in Brazil. And this movement is a social movement no research, no financial resources. We didn't have any financial resources, but we reached over 750,000 people with our social media. We published many guidelines, many ebooks, many scientific articles about care and about long-term care facilities. That was our resources, our big resource. We should share information. We should help people to know how to wash hands, how to use masks, how to maintain distance, how to preserve lives. We should say we were in a country with a very negationist president, so we didn't have any help from the federal government. And if we were waiting, we should wait just now. So we should do despite many, many difficulties. And we have a big country, an unequal country, and we don't have internet for everyone. We don't have this social media. There is a case very interesting. In Salvador, Bahia, someone were watching our webinar, and they called to someone inside the state of Bahia to tell them, hello, you should like this. We are have some advertising for many things to do in the care of the long-term care facility. So it's like a radio. We should share for many, many strategies. And that is the riches for this movement, this social movement.
So I just want to go back and name it again, because I think it's really important for us to understand what happened. You know, it's the National Front for Long-Term Care Facilities. And from what you're saying, Karla, you know, the public health messages were not being communicated effectively by the government or by the state. And so, you know, scientists and geriatricians and people with evidence came together, the grassroots movement, and responded. And what happened was there was a massive snowballing where 750,000 people were actually receiving accurate information about COVID and also about vaccines and social distancing, etc.
Absolutely. And always free information. That's another thing. We should not pay to participate. You should not have any fee to participate, because our commitment was save lives and was to promote the notion that institutionalize older people lives matter. That's our commitment. And it was very hard because our groups are very heterogeneous. So we have the both sides, those who believes and those who not believe in scientific information. And we should have we should be credible, you know, reliable. And that was our central point, to share, to be based in evidence, in scientific evidence, to translate this in a simple language, because we were talking with illiterate people, we were talking with people with very low educational level. So we should do all of this to translate scientific information in a very popular language, but not lose the central point. It means the real notion of biosafety, the real notion of care in the long-term care facilities. And there is another thing very, very interesting. 25% of our long-term care facility are from philanthropy, are from non-profit services. And their central group told us, Karla, we have a big news for you. We have less death during the pandemic than we have before. So we learn how to care with you. Do you know?
Yes.
It's amazing.
Yes. You know, I want to pick up on a couple of things that you said, you know, about shaping the messages to really communicate effectively to those with different levels of literacy.
Mm-hmm.
You know, in high-income countries, we do this very badly, very badly.
Mm-hmm.
And beforehand, we were talking about reaching, you know, the Amazonian population or reaching those that were living in Valhallas. So how did you communicate with, you know, these communities who are very at risk of infectious diseases? How did you go about that?
At the beginning, as we have more people than the WhatsApp could support, we should share in groups, and we share in regional groups. So Amazonian stay inside the same group, and we could share information inside this group. And someone in Pará who could help someone in Rondônia, another state in Amazonia. Do you know?
Yeah.
So they share information because they were at the same level. They had the same resources. But for example, in the south, we have many people with more literacy. So it was easier to share some information. In the Northeast, we were talking with people with very low level of literacy. So we could make some arrangements to do this. But it was very how can I say? The more we do, the more we want to do, because we know we were changing some lives. Do you know?
Yes.
It was a transformation. It was a revolution.
Yes.
Like this.
So this, I mean, it is a revolution. I mean, what's happened is that really you've seen an issue, you've seen a problem, and come together to create the solution to save lives. So this is a very complicated thing. How was it coordinated? Who coordinated it?
Yes, we have some webinars, and we have some leaders inside these groups, and it's a dynamic movement. So each time we should do something. So at the beginning, we should have a report to say how we could act if we have some suspect case of COVID, how we should act if we have a death inside the long-term care facility. So we made a report, and this report was sent to many long-term care facilities in Brazil. It was used by a non-governmental action named Todos pela Saúde. It means everyone for health, financed by a bank, a huge bank in Brazil, and it was used for for help them, we contracted, not we, but this bank contracted some actors, and these actors made like a novel in Brazil. Do you know? Brazil has this series in TV. We made a little series in TV with some situations. For example, someone wants to visit their her mother, but it's not possible now. What could you do? So how to communicate with someone inside the long-term care facility by phone, by video phone, by the window, through the window, do you know? Many types of, many examples I could say to translate and to transform this in a possibility to help people to understand.
It seems, Karla, that fundamental to your work is rights, human rights, the rights of everyone to be able to receive information and be informed to make decision. Is that one of your reasons for being, to protect the rights of older people?
Of course, and to do a network, because they were very sparse. They were not together, and now they work together. When you asked me how you lead this, now we have some groups by professional category. So the nurses are worked together to help people. Social service are together to help people. Physiotherapists, ergotherapists, do you know? So
Yes.
we are creating a network, a strong network with this in their professional category, but also thinking about how can I do something better with our resources. As we don't have new resources. The only resource we have is information. And we think we are getting this.
I mean, it's very inspiring. And, this work, as well as your previous work across your career, is, the body of that work was recognized by the WHO in you being one of the Healthy Aging 50 awardees this year. But I want to actually move on to start talking about inequalities again, because you've done some work around territorial inequalities. And I just wanted you to touch on that for a moment, the work with Peter Lloyd Sherlock that you've been doing to unpack inequalities.
Yes. For example, Brazil, more than 76% of cities and towns in Brazil don't have long-term care facilities whatsoever, do you know? So family should care. But which family? Who is this family? So we have, in Belo Horizonte, we have one program called Programa Maior Cuidado, which takes place in deprived communities. A carer lives in a poor neighborhood, and they work for a family in a poor neighborhood as well. And why? Because I couldn't hire a caregiver to work in a favela, for example. Do you know? Someone who works in a favela could be able to cope with this reality. So they care for a frail older person who lives in a very vulnerable area. Each carer can look after 3 to 5 older people because each day has a routine to follow. It takes time. They have a schedule to do. And each carer has this routine, and they discover also how to help these older people. This routine is composed by an integrated care as the third dimension of the health aging for
decade.
the decade. Yes. So the social and health assistants work together, and they working only during the week and during the day. They can't help them during the night or the weekend, but they are able to help many people. And this program was also being selected by the WHO in the framework for continuing care of the WHO. So we should be very creative to propose some solutions, because we are a very poor country, very unequal. We have many rich people. That's not the point. But we have the majority, the poor people, okay?
Yeah. I just want to talk about policies, Karla, and then we'll go to some questions from our colleagues on the cafe. And, you know, ordinarily, you would gather data to then inform policy. But it seems to me that in many countries, even in high-income countries, the collection of data around older people and their needs is very sparse. So how does policy become developed, you know, in your city, your state, for example? How do you, as a geriatrician, help inform that policy?
I should use again the example of the National Front, because we create a group of diagnosis and research, and we should, this group help us to find this information, because this information are sparse. So that's why now we know Brazil has more than 7,000 of long-term care facilities. But if you look for this inside the public services, you will find only 1,600 long-term care facilities. So they were not on the radar of the public services. Again, we have many challenges, because we didn't have the census of the country because of the pandemic. Now we are doing, but we have some gaps on information. So the public health system has many information. The social assistance system has also, but they don't connect. They are not connected, do you know? So they are systems apart. So it doesn't help us to be a planner. So
it also seems that in different settings, we need to be creative and innovative in the collection of data. You know, that, you know, it is not a routine systematic model. We've actually got to use, as you say, we've got no new resources. We've got to use the resources that we have to gather the data. I'm continually intrigued with this National Front. I mean, this National Front is one of the most powerful bodies of people that I've heard recently. And you're using WhatsApp, is that right?
Yes.
Yeah, go on.
No, and you will use WhatsApp, and we did many answers. We did at the real time. Do you know? For example, it was 5 in the morning, and someone sent us a message. Please help. We have a case here. How could what should I do? And our nurse helped them. Once, Jane, it's unbelievable. Once a mailer tells to close a long-term care facility with all of the residents and all of the services inside during 1 month at the beginning, the COVID pandemic, because they closed. They were forbidden to leave. Could you imagine this? And the mailer said, you should, we don't know what will be, what happens, but after this 1 month, you could leave again. It's insane. And we were out and sent to them what they should do. How can help them to have some relief, do you know? It's unbelievable.
So really, you have been on the front line for a couple of years now, really. You know, responding, because one response could actually save a life. And I think that this is what the National Front has done, but also it's a powerful influencer, isn't it?
Yes, and we have one of the lowest rates of death in long-term care facilities because of this. We are convinced that, do you know? Because the many long-term care facilities told us, we are now visible. We know we can help you someone now because you were there, not you, Karla, you, the National Front, okay? So we are very proud of this because we could show that it's possible. When people decide to work together in the same goal, we can do better. We can transform the world, do you know?
Yes, we can, you know, but what you have shown in the National Front is something that is not tangible, and that's courage. You know, and, you know, there were many countries across the world, not in the same situation, different, but we haven't seen that same coalition in response to important gaps that have saved lives. So, you know, intrinsically, there's an ingredient in you and the National Front that places it, you know, for us, you know, to look at and really consider how we need to step forward, you know, and represent and protect, you know, the rights of older people. So, Karla, we have, you know, a couple of questions. So I'd like to, because I could keep talking with you, but that would be very greedy of me. So I will ask for Shmuel. Shmuel is a regular on our global cafes, and he really wants to know, what is the role of government in long-term care facilities? You know, is there some standards, accreditation? You know, what are their views about long-term care? And it's a very big question, but that's the sense of the question.
Indeed, Brazil has many prejudices about long-term care facility because some family who put someone in a long-term care facility has some prejudice, some social prejudice because of this. So the government has the same prejudice. So they don't put many resources. I could translate to you. Brazilian minimum salary, the minimum income, is about, I should say, $250 American, okay? Something like this. And the government put, how can I say, less than $50 per person per month to cover all the services in the long-term care facility. So this could answer you how long, how many this government invest or not invest in long-term care facilities. They don't regulate, they don't finance, they don't monitor, they don't know anything about them.
And you're one of 2,000 geriatricians in a population of 210 million with 34 million people who are older. And Brazil is a rapidly aging population.
Yes.
So, you know, every day you are confronting not only the inequalities, but the lack of standards and regulation and, you know, lack of investment and lack of finances for just individuals to survive in Brazil. So it's words fail me. I will go on to another question. So, Diana, are you on the line? And would you
Yes, I am.
Good, thank you. You've got a question for Karla.
Yes, I was wondering during the COVID time if somehow the Frente Nacional VLPI had measured the impact in social isolation and depression. I know it was very, very hard. Keeping it closed was probably the best measure at the time, but I know we had a lot of impact. I was at the time working at one ILPI, which is a nursing home group, and we felt that very, very strongly hitting the mental health and the social isolation. Did we measure that somehow? Do you have any studies on that?
I think there are some studies on that, but not by the National Front. Many researchers asked us to share some research inside our groups, and we always share. So some group are looking for this, Viridiana, but I don't know any answer up to now. Okay.
Okay, thank you very much. Karla, I want to return back to this database that's been developed of long-term care facilities, which once again, you know, has come from the ground up to understand the number of facilities, the nature of facilities. You know, what kind of work can you do with this database going forward? Is there some thoughts about how you can coalesce around looking at gaps? What's your thinking?
We are now asking how to use this data, but more than this, how could we do a census of the long-term care facilities, you know? Because, for example, Jane, 1.1% of the long-term care facilities are in the Amazonia region. 11% on the northeast, 60% on the southeast, 17% in the south of Brazil. So each region has a reality completely different of other, do you know? So we could know more. For example, one state of the northeast, in one state, only 2% of the cities has a long-term care facility. 8% don't have. How they care? How they care when family cannot care anymore? Do you know? So there are many many gaps of information.
Yeah. Just turning to, you know, the family and the role of family in Brazil, and I know it's heterogeneous, so it's a big question. But with such a lack of long-term care facilities and also facilities in the community, you know, how does the family balance this important role of caring, but also lack of services? What's the ultimate result with this imbalance?
I'm also a researcher in the ELSI Brazil, the longitudinal study of older people in Brazil. Is a kind of NHR study, okay? It's the family of NHR study. And we discovered that 24% of the carers, the family carers, should stop to study or stop working because of care. So we are creating another generation of vulnerable people because they don't have work, they don't have resources. Another thing we should say that now in Brazil, the old people has some resources, the financial resource, because of the social service, because of the retirement, and they are in many families, they are the most important source of resources in the family. So we have a research that that shown that when one older people died during the pandemic, their family become poor, you know,
Yeah.
because they lost a source of
Yeah, a source of
financial.
income. Yeah.
Yeah. Mm-hmm.
So it's quite a fragile community in many respects.
Mm-hmm.
Balance. What about the role of older women in Brazil, Karla? You know, how does that manifest as women grow older? What is their position in society?
Well, Jane, I understand that we have a Latin origin, so somehow we respect, somehow we care, but in many times we hurt because as we don't have any resource to care, violence against the older women is a phenomena very frequent too. Do you know?
Yeah.
Another thing, men could believe that they will be cared, but not women, because men will be cared by a women, but not the in the other side, you know.
Mm. You know, every day, Karla, you see the best of the best and the worst of the worst, you know, in human beings. How do you maintain your inspiration and your courage and your resilience in the work that you do?
I think it's our proposal. I think I could know now. I can know now. I didn't know it before, but I understand that I do this because I want to help my country to reduce these inequalities. Do you know? I know it's a very utopic, but I think we should do. We should continue. We should restart many times as necessary.
So in my language, it's almost as if you may fall over, but you have a responsibility to get up again.
Yes, of course.
And keep moving forward. And the National Front is a demonstration project for the world that you came together in response of a lack of information and a lack of political will. And through coming together across sectors and disciplines, you saved lives now and in the future. So the National Front is a very symbolic place, you know, in this conversation about civil society.
And I think our vision is to construct a national policy of care in our country, because it's absolutely necessary. It's unquestionable. Do you know?
Yes.
In Brazil, our constitution says family, society, and state should share the guilty of the care of other people if they need.
Yes.
The only from this only family has address.
Yes.
Society is heterogeneous. State is completely absent. So the National Front is a little bit of this society role, do you know? But it's how can I say? It helps us to dream.
Yes.
Also.
Well, I think it helps us all to dream. Because you have demonstrated, you and your colleagues have demonstrated that while the road is very complicated and long, we need to start somewhere to actually stand up for the rights of not only older people, but all those people that are vulnerable in our society. And that may include children and people who have low levels of literacy and living in poor conditions. So we have a responsibility for that. I'm just going to send a note. Judy Robbie said that she's a great admirer, and she's on the line now, and she sends wishes. And Mary
Thank you, Jude.
Mary Ship made a comment about the data collection and the importance of that. And Viridiana, would you like to pose another question to Karla before we start wrapping up?
Thank you. Yes, I just wonder if is it the right time, or are we ready to strongly promote institutions and ILPs in Brazil, or how should we all support that to break this cultural barrier that is so strong? And do you think, Karla, that we are ready and we do have quality, enough quality? Do you see that we are ramping up and having more good services, and that we really should promote that, because we always listen that families really get in a very strong burnout, and as you really mentioned, and the impact that we have in the families that care for an elder. So how do you see that, please?
Thank you, Viridiana. I think it's very necessary to help everyone to deconstruct this prejudice against long-term care facility. This prejudice is based on the invisibility, is based on the fact of the many long-term care facility are closed, so they are not visited, they are not open to the communities. So we have many things to do to help them to change our way of working. And another thing that many people thinks that the long-term care facility should be the last option, but many people die before to achieve this chance, you know. In many cases, many older people could be more strong or more being more cared inside a long-term care facility than in our families.
Correct.
So we should have many chances to communicate, to help our society to deconstruct this cultural barrier.
And this is something that the Frente Nacional is trying to do, or is looking forward to?
Of course.
Okay.
In our manual of care and gestion, we talked about this. There are many insights about this. Okay.
Okay. Thank you.
Thank you very much for your comment. Karla, as we wrap up for the end of the session, I'm just going to leave you there for a couple of minutes. I'm going to introduce the next session, and then I'm going to come back to you and thank you. But I would ask Bruna, would you have the honor of closing the session and thanking Karla today? So I will introduce our next speaker. And Francis, your point is well taken. The lack of geriatricians is a problem everywhere. But I think Karla has really shone a spotlight on, disparities, across the board. But I'll leave that for Bruna to wrap up. So from me to you, Karla, I honour you and your courage, and you have taught me many things today. So thank you for allowing me to be in conversation with you. So next week, I will have the great pleasure of being in conversation, as you will too, with Nini Wang. Nini has been and is a leader in the development of long-term care and integrated care in China. Not an easy task. And at a very early age, she stood up and really founded Pine Tree Care Group, as her symbol of change in the long-term care and integrated care sector in China. So join with me. Nini is not only well spoken in what is happening in China, but an international leader in long-term care. So join with me next Friday at 7 a.m. So Bruna, the floor is yours.
Thank you so much, Jane, for this opportunity. And thank you, Karla, for being here with us today. As I said before, I could not be prouder of having someone from my hometown, not only my country, but my hometown, representing Brazil in such an amazing way. I think before we go to your final notes, that I would love for you to address your final message to the audience, and especially to us here in other countries, and us Brazilians seeing Brazil from abroad. I would like to thank you for making me realize all those gaps and challenges that every family lives. Like I could say from my personal experiences, seeing the differences, the gaps throughout the generations from my family, seeing how my own grandmother, great grandmother, they were not, they couldn't count on long-term care facilities and support because of this challenge, this cultural barrier that you mentioned, that they cannot be trusted. I clearly remember how my family has been avoiding going to those places and looking after family inside the house, and how that has impacted the family. As you said, and I think of all things that you've mentioned, this resonated with me. If we don't do something about it, not only in Brazil or in other places, we'll just keep going back to the same problem, or even worse. Because the moment someone has to stop working or studying to look after their family, despite cultural background and costumes, it prevents that person from moving forward and being able to provide for their own family. And I lived through that. I'm the first person in my lineage to be able to attend college, for instance. My own mother wasn't able to go beyond high school because she had to stay home and look after her mother and so forth. So yes, it makes me really happy and hopeful to see all this work being developed, because it's not only about older persons, it's about everyone. It's about the future of society in Brazil and other places. And I hope we all learn a little bit from your courage and from your hard work. So if you could please just give us your final notes on this session, I would really thank you.
I'm really thank you too, because I'm very proud of this invitation, but I should say, as IFA, as ILC, as National Front, all of us together, we could do more and we could do better. So that's the point. We should reinforce our networks. It's necessary to all of world to know more about the less developed countries, about the reality of care in these vulnerable areas, and we should do more and better if we work together. That's my comprehension about this. Thank you so much.
Thank you so much. Thank you, Jane, for this amazing session, and thank you all. Obrigada. to the Brazilians who have joined us and to our audience. And it's a pleasure being with you every Friday morning on Global Cafe. So stay safe and have a great weekend. I look forward to seeing you next week. Thank you.